Amanda changed this because she didn't think that this was positive enough. But what I say is I'm a social worker, and of course nobody knows what I do. So right here, this is going to be a video from the National Association of Social Work. And here we go. This is going to be an overview of what social workers do in general.
Social workers are dedicated to enhancing human well-being and helping meet the basic needs of all people. We work to empower people who are vulnerable, oppressed, or living in poverty. Social work has been around for more than a century. Our profession has been instrumental in pushing for major social reforms, including Social Security, the minimum wage, and equal rights for minorities, women, and people who are LGBTQIA. We need social workers now more than ever. Today, social work professionals are tackling issues that include income equality, access to health care, and care for our aging population. Social work is one of the fastest growing professions in the country. There are more than 700,000 social workers in the United States, and that number is expected to rise to almost 800,000 by the year 2028. Social work is incredibly diverse. You'll find social workers in mental health, substance abuse treatment, healthcare, family and children's services, aging, in schools, and in local, state, and federal government. Learn more about the life-changing support that social workers provide at helpstartshere.org.
Okay, so right there you understand why it's so difficult to understand what social workers do, because we're everywhere. So I'm going to start off with a little brief intro about myself. My name's Alana. I'm a licensed clinical social worker, and what that means is that I have a bachelor's degree, I have a master's degree in social work, and to get my licensure, I had to have clinical supervision and training for another 3 years after that. So then I had to pass this national exam. That was super tough and stressful. And this is very similar to physicians who are board certified. It's like that extra step that you take after that. I am a member of the National Association of Social Workers. They have a strict code of ethics that I follow. And just generally, you can think about social work as the helping profession. So one of the part of ethics is that I provide service to people, social justice to help people who are in need and address social problems. I tell you, social workers are prepared. That's why I don't ever wear high heels. Okay, so dignity, respect for the person, their inherent worth, including individual differences, cultural and ethnic diversity. I work to empower clients with their capacity and their opportunity to change and address their own needs. So I don't do things for people, I teach them how to do things so that they can be empowered themselves to do that. Relationships. This is an important way to help people with change, engaging partners in the process of helping, strengthening relationships to promote, restore, maintain, and enhance the well-being of individuals. And one way to kind of narrow that down is that a lot of families, I am finding, are disconnected from their other family members, from their children, because they live further away. So trying to strengthen those bonds back to help them have better future outcomes. Integrity is a huge part of being a social worker. I'm required to behave in a trustworthy manner. You would think that would be obvious to most people, but that's does not always happen in today's society. Acting honestly, responsibly, and promoting ethical parts. I'm part of the organization that I'm affiliated with as well. So like we were talking about before, there's many types of social workers. I specialize in healthcare and in aging. So a little bit of my background is that I have worked with many other populations in a variety of settings. I've worked from kids, adults, teenagers, geriatrics, people at the end of life. Previously, I worked at, I came to Fixel. I've been there about 2 years now. Before that, I worked in hospice care for 7 years. I've worked in governmental agencies with Medicaid policy, people with developmental disabilities at Takachali. So, but what do I actually do here at Fixel? So pretty much everything is how I like to say it. Things that make the doctor's jobs easier, things that fall outside direct medical care. So this is just a little bit of some of the things that I do. It's a long list. And so kind of narrowing it down, I like to think of it as I support the persons with Parkinson's, their caregiver, and other people who might be involved with the care. Sometimes it's other family members, sometimes it's friends, sometimes it's a whole network of people for the person with Parkinson's. And I coordinate with our team at the clinic, of course. We meet regularly together so that everyone's opinion goes into the care of the person. So, when do I need to see a social worker? Don't wait till the last minute. You want to do this sooner rather than later. It's going to save you a lot of time and stress. Planning ahead of time is going to help you out. So, let's see, what slide am I on now?
Yes. A follow-up for that, how often does a client get to see a social worker in their ongoing?
So I'll answer that briefly, and then we'll have some time for questions at the end. So I would say as often as you feel a need. People can call me. You don't have to come in for an appointment. You can call me. We can do a Zoom call. We can meet in person. If you're there at the clinic seeing the physician that day, you can see if I'm available. So I try to be pretty flexible with that. Okay, so getting back to that list of different things that I do, the first thing I do is identify when social work can be of assistance. New diagnosis is a good time for that. When someone is going into a hospital or coming back out of a hospital and things are changing for them. Maybe there's been a change in their supports. Maybe their sister has been staying with them and has to go back home suddenly. And then how are things going to change then? If things are starting to get harder to do, functioning, activities of daily living. For people who also need information about Parkinson's disease now, and maybe some resources to think about in future. So the next step that I go to is an assessment, and I do my assessment based on Maslow's hierarchy of needs. If everyone's had some basic psychology, they should be familiar with that. So again, this is all about self-respect and emphasizing the person's independence and what their choices are. So the assessment I do is a pretty thorough one. How is someone doing right now, today? Kind of like a snapshot of how they're doing. And this is going to be up online on our YouTube channel.
Oh, good.
So yes, so this will be up there. I don't know how long it takes to get posted, but it will be up there, and you'll be able to look through it then. So I like to see basic things that someone needs right now. What are things that are already working for you that we might be able to build on in future? Who are the people who can support you? What do you need to continue doing well for yourself? How do your personal beliefs affect how you want to be treated? Do you have special cultural or spiritual beliefs that we need to know about so that we can be respectful in working with you? And then what are the future things that you want for yourself? So I also research and refer. I am very good at finding out resources. However, there are not resources for every single thing. Just want to make that real clear. Our government does a lot. There's a lot of agencies that do a lot, but there's just not enough for everything that's needed. So I can help out with finding care agencies, supports for caregivers, because caregiving is hard and people need some help with that. Different living arrangements may be needed at some point. I can help out with people getting different benefits, Medicare, Medicaid, disability, things like that. I'm here to be an advocate for you. This can take place both within our facility there, sometimes at a local or a state level. There are things that may come up where maybe there's some paperwork that's not being filled out and someone doesn't necessarily know how to do that themselves. I can call up the agency and I can speak with them to help get the process moving again. So education is a big part of my job. We do have the Parkinson's Disease Foundation Rainbow books. Those are always good for people who have new diagnoses. It covers a variety of things: caregiving, sleep disorders. There's a whole table of them actually in the main auditorium that you can take a look at. You can pick those up when you come to the clinic as well. I can talk to people about how to apply for disability and other programs that they've not thought of that might be able to help them out, such as Medicare and Medicaid. So I develop and evaluate different plans, just trying to help round out kind of being proactive for things that people may need in the future that they haven't thought of. So talking with new patients when they come to the clinic, providing some supportive counseling. I would like to expand that more. We have a little bit of that I do brief interventional counseling, but I do not do several sessions of counseling with people. That's something that I would like to do in future when we have some more social work support there. I'd like to be doing more educational programs and putting out informational materials, but I also need feedback from people who are getting these to see if it is meeting their needs. So please, I do welcome any feedback that you have if you're coming to the clinic. So collaboration is a big part of my job, working with the other team members within the UF Health system, going out with other, outside to other community and higher level agencies. Things like that might be the Department of Elder Affairs, trying to make memberships with other agencies in the community, such as maybe having some PD education at different places, like maybe the Village or maybe some of the other facilities in town. So reassessment. So maybe I've seen you the first time when you came to the clinic initially. When someone comes back, I may not see them, I don't see people regularly unless they ask for it. So I might not see them for 6 months, it might be a year, it might be 2 years. So I need to kind of go back on my notes and see how were they doing the last time I saw you, and how are you doing now? What's changed? Are you holding pretty steady? How's your partner doing in caring for you after several years? Have your goals changed because maybe your health has changed? Are you thinking maybe I want to move back with family? Out of state, there's different things. Our goals don't remain the same over our lifetime. They change and develop. And maybe it's at a point where some additional resources are needed to help with your care. So, future planning. I do help people with future planning quite a bit. This slide didn't say, that picture right there didn't say quite what I wanted it to. I would say the best way to predict the future is to plan for it. And planning will help you create it. So these are difficult things that people don't like to talk about much. But first of all, we need to have advanced directives in place. How many people here have those? Can I, if you don't mind, show a hand? Okay. I was a hospice worker. I don't have my advance directives in place, mainly because my husband does not want to talk about it. He is not ready for that.
Good for you, because I'm a retired lawyer and I don't have mine in place.
7 years I worked at hospice. I've been talking to him. He is just not ready for that. And that's okay. We will get there, hopefully, but things happen unexpectedly. So future planning is going to protect you. If you were able to at least have a conversation about this, have a conversation with your family. If you don't have anything written down, at least having discussed it so that someone can say, yeah, I remember mom or dad told me this is what they wanted. Might not have it written, but that may be able to help the family come together if that is needed. Future planning also to consider care needs changing as someone goes from early to mid-stage Parkinson's, and then those needs will also change from going from mid-stage Parkinson's into later stage Parkinson's. Okay, I provide some counseling services like I talked about before. These are usually brief. I do a lot of support when I am meeting with people because they're dealing with difficult circumstances. Communication between couples is a big issue when a caregiver is stressed out. That's when differences in a marriage can really come up. I also provide some grief and pre-bereavement counseling. So we do have support groups as another support. Our care support group, and that is for care partners. That is on the first Friday of every month at 11 a.m. And then the Parkinson's disease support group for the people with Parkinson's is on the third Friday at 12:30. Anyone is welcome to come. You don't have to be a patient of the Fixel. You can also come to Zoom meetings. I have that on the next slide. So if you would like to get reminders where we send out our emails, I send out emails a week before each of these meetings. You can email either me or Amanda.
Can I just write that down?
Yeah. So it's alana.mckay@neurology.ufl.edu.
Thank you so much.
Yeah. And Amanda, who is the person who is setting the symposium up, she is the one who actually has the distribution list, so you can also email her. And then that was it. I went through that super quick. I was worried about time, that there wasn't going to be enough time. So we've got plenty of time for questions and answers.
Are you the only?
I am the only social worker there right now. And I'm actually covering all the clinic. I'm not doing just people with Parkinson's. So the caveat to me being a social worker to be there to help you is right now my time is pretty full and I do not get back to people as quickly as I would like to. However, I will get back to you and you can call me a second time if I haven't gotten back to you fast enough.
One of your first slides was about, you talked to them and said, what are your basic needs? And there was a whole list.
You want me to go back to that?
See that again.
Sure.
It was sort of in the beginning.
Yeah, we can find that. I am.
That was one of the ones, the only one I wrote down was one of your basic needs.
Okay. I'll go back through these real quick.
That was it identified?
This one,
No.
the hierarchy of needs.
Exactly.
I didn't, yeah. Assess.
Okay,
Yeah.
okay.
What
So,
are you doing right now? How are you doing right now?
yeah,
That's a very non-threatening question is to say that, how are you doing right now? Because when I said, well, what do you, here's some of the things you need, how are you going to achieve that?
yeah.
That's not a good way of doing it. It doesn't work.
Well, when I ask people how they are doing right now, there's a lot of things going on in my head when I ask that question. First of all is, how are you doing physically? Because that physical side is going to impact everything else that we're doing. How are you doing emotionally, just getting this new diagnosis? How are you doing spiritually? For some people, faith is a big part of, or their beliefs are a big part of where they're at. And some people feel that they have done something wrong to get a disease. Not everyone, but sometimes people do. So that takes some adjustment to, kind of work that out a little bit. What else was I thinking of?
So what if they say to you, you're ashamed of me, and that is nowhere in anybody's thought process. That's in their thought process, because that's how I think that they are feeling.
Yeah. If I have the time, I will talk with them and I will process that through with them.
Okay.
Part of it depends on how long the interview takes. When I do my first psychosocial assessment, that can take 45 minutes to an hour. Because we can get pretty thorough and deep into some different things, because I'm going to want to know specifics, how many times have you fallen in the last 3 months?
Okay.
Are you having difficulty swallowing? Who do you have for supports? Who can you ask for other supports? How can you build up your network and your relationships? What are your goals? Have you thought about what the end of your life might be? Where do you want to be when that happens? Who do you want to be around you? Things like that.
That's also good thoughts. You want to be around you.
Yeah.
And so the difference, would that also be like a psychologist or a psychiatric therapist working, or the social worker would basically help through that?
So let's see. There's a lot of different ways to answer that. At our clinic, we have a psychologist and we have a psychiatrist. Their function is different from what I do, and I don't think they go into those kind of things. And I'm sorry, bring me back to exactly what you were asking about again.
The question was that they're saying that we are ashamed of them when that is thought has never occurred to them, because that's how they're feeling themselves and isolating themselves.
Okay. Yeah, so I would talk to that person about grief. I think that's a matter of getting adjusted to their disease. Grief that maybe some of the goals that they had, maybe they may not achieve them. We all carry these goals with us. Like, I did weaving for a while. I bought this loom. I spent several $1,000s on it. It is still my goal. That thing has been in storage for more than 4 years. It is still my goal to get back to being a weaver. Now, is that ever going to really happen? Maybe not. If I were to get Parkinson's disease and I had trouble with fine motor control, that may never happen. And that's a dream that is dying that I have to come to some kind of terms with. And that's just my personal example. I hope some of that can relate to what you were getting at. Yeah.
So you see that maybe possibly as grief.
I see that partially as grief. Yeah. Yeah, for sure. Yeah. And you have a question?
I did. There is a one person there, but I'm curious about, in trying to find, I'm working, or not working, I'm enjoying the company of several folks with Parkinson's. And I hear from them, I don't feel like I can drive anymore. I don't feel like so there's a lot of community issues about how you provide services. I know that you can't do all of that. Is there a resource or network kind of thing that we could start looking to try to figure out how to get folks what they need?
There's a lot, Parkinson's, it's called snowflake disease because everyone is different. You probably have all heard that, probably tired of hearing that. There are so many different resources that people with Parkinson's disease need that it is hard to say, like, here's a list. Okay, so one suggestion is the United Way 211. They are like the telephone directory. Y'all are of the same age. You know what a telephone directory is. The younger folks don't. So you can call them up. You can say, this is the problem I've got. Do you know of someone in my community who can help me out?
So that's United Way
211. Yeah, that's the number that you dial for them, 211, and I'll get you through to United Way. So the driving, I do have a specific answer for that. There's a program through occupational therapy at UF called the Smart Driver Program. We actually had someone present on that either last year or the year before. You would be able to watch that video on the Fixel YouTube channel. And the woman, I think her name is Beth, I don't remember right now.
It's called the Smart Driver?
Smart Driver Program. So it is a program where they will take you through a thorough assessment of several hours of first doing a virtual driving kind of exam to see how someone does on that. If they do okay on that, then they will take them out on an actual physical driving to see how they're doing. They will make suggestions and they will make recommendations that maybe you can still drive, but maybe not at night, or maybe you should consider always having someone in the car with you. It's not like a yes or no kind of answer. They try to help you out with finding ways to stay as independent as possible. There are alternatives for transportation, so those are other resources. They're not great. Let me just say, we're in a very rural part of Florida, going from, Pensacola up to pretty much us here in Gainesville and maybe even down to Ocala. Things are spread out. Mm-hmm. So transportation is really tough in Florida. There is transportation through what's called the Committee for Transportation Disadvantaged, and there are different providers in each county. Here in Gainesville, it is MV, and there's different ones in other counties who are around. But if you look up the Commission for Transportation Disadvantaged, that can give you some ideas on different transportation. So transportation's tricky. Yeah. And what kind of other resources were you thinking about?
I guess someone who could, there seem to be a lot of questions that I'm hearing about different kinds of meds that they're taking, time released or non-time released, and they don't, some people don't know anything about it, and getting that information out. And they might not be the type of person who's really going to ask it in a medical situation.
You know, what I suggest to people when they come to appointments is that they have some questions ready, because you get that white coat syndrome. You're talking to the doctor. The doctors at our clinic are usually like pretty charming, and it's like you can get sidetracked really easy with them. Dr. Ramirez, I tell you, love him. He's great. But, you just start talking and chatting, and then you forget, I came in here to ask medical questions because,
Do you suggest that the PWPs bring a written list?
Bring a list. Have it prioritized. Don't come on there with like 8-10 things on the list, because they're not going to have time to get through all of that with you. Medications, I don't know. I do not get involved in medications at all. I know the names. I know a little bit about the timed and the continuous release and things like that, but that's not my ballpark. They get paid to do that. I get paid to do my own thing. I can help out with things like if people are having trouble accessing medications or the co-pays for them. There are some programs that help out with that. So, okay.
That's good. Thank you.
Yes. What is a living will?
A living will. So a living will is about medical decisions only. So it is not a binding legal document. It is good to have it written out. So again, like, say someone has 3 children and they haven't named anyone to be their healthcare surrogate and they don't have a spouse any longer. Say they're widowed or never got married. They got 3 kids. 2 of the kids live out of state. One's been the caretaker for mom all this time. The one who's been the caretaker has heard mom say again and again, I'm ready, I don't want anything more done, I don't want to go back to the hospital. The other 2 children who haven't seen mom and don't know how bad off she is getting, they say, oh no, we need to try everything. I think she's got years left. When those 3 children cannot make a decision together, that's when a living will is helpful because it says, this is what mom wanted. Mom did not want to have a tube feed. She would want artificial respiration if it looks like she's going to survive. She may or may not want chest compressions.
So does it need to be signed and notarized?
A living will does not because it's not legal. It's not a legal document. It's more of a discussion kind of opening that up. A healthcare surrogate form is a legal document. That one is notarized. If you get a healthcare surrogate done, make sure you have copies, your providers have copies, the person who's the healthcare surrogate has the copies. You can't get enough copies out there. Just make sure it's there, okay? And
it would be one of those things that you want to take to a hospital with you, right?
Yes. You can have it put with UF Health. You can get that scanned into your records, and that way anyone in the UF Health system can see it. Okay.
Thank you so
All right.
much.
You're very welcome. Thank you. Thank you.